Next, move on to Dr. Kirk Milhoan, a pediatric cardiologist, I think both Texas and Hawaii. Dr. Milhoan, why don't you introduce yourself, tell us your qualifications, and make your presentation.
Thank you, Senator Johnson. Privileged to talk with you again and be on this panel. Got my PhD first in cardiovascular physiology and pharmacology from UCSD. My specific area of study was looking at the pathway for inflammation within the myocardium. And then eventually went on to get my MD and then became board certified in pediatric cardiology. Early on in this, when COVID first came out, it was acting down and it affected the body in pathways that I was familiar with. And it all started sort of revolving around how it acted on the endocardial endothelial cells and how important those are for maintaining blood that does not clot and maintaining the health of tissues. As it comes about to, as we've learned now, much of what we're seeing is related to the inflammation that is caused specifically by the spike protein. The data are now out, and it's very clear that it acts through a number of pathways. It acts in more pathways than probably we even understand right now. But one of the main pathways that it acts is through an inflammation pathway that's similar to gram-negative sepsis. And for all of us in medicine, gram-negative sepsis is a very dangerous situation where there's large whole body inflammation that affects multiple organ systems. So as it's coming out, it's very clear how it acts is as an inflammatory induction. And when you have this inflammatory induction, that often leads to cell death, and then cells that die are replaced with fibrous tissue. So that's what we're seeing in the myocarditis. If people survive, even in children, we're seeing these scars that last and aren't going away. And these scars are associated with sudden cardiac death. So what I'm seeing as a pediatric cardiologist, I'm taking a break from clinic right now to speak, but what I'm seeing, I'm probably in 25 years of doing pediatrics and pediatric cardiology, I had never seen a vaccine injury. Now, since COVID vaccine came out, I probably see one every week, or at least I'm suspicious of it. And what I'm seeing in kids, we're seeing less myocarditis in the children because most of the parents have realized that this is not a safe vaccine for their children to take. So the number of vaccines are going down. We still have a number of children who are at risk because of the scarring of their heart, that they will always be at a certain amount of risk for sudden cardiac death. But what I continue to see is this tachycardia syndrome, and this is what's filling my clinics now. And patients know it because of their Apple Watch or their Fitbit, and their heart rates are going from 40 up to 180, down 1 to 150, then to 120, then to 60, and they're bouncing around. And the people come in and complain. And typically what the doctors do is they evaluate them with a long-term measuring of like an EKG called a Holter monitor. And they go, oh, it's all sinus tachycardia, so that's fine. And they ignore it. And a lot of my colleagues aren't even curious. I'm very curious about this because it's not acting like a postural orthostatic tachycardia syndrome called POTS that we're aware of. These changes in heart rate are occurring while they sit and are at rest. But for some people, it's incapacitating. What I'm amazed about is that that COVID now and COVID vaccine has become very important part of my history from the patient. I don't ask about all the other vaccines schedule, but this one's very specific that I have to ask. And that's what I desire for my colleagues. I wish they would become more curious. It seems like doctors have lost their curiosity and have lost their ability to say, wow, we have a correlation, maybe there's a causation. Now we have all the data, as the presenters before me showed, we have actually all the data. We have the biochemistry data, we have the genetic data, we have the inflammatory data to show that the spike protein is cardiotoxic, and it's toxic to many other organ systems. And this is not questionable anymore. We know this. So we're very careful as pediatric cardiologists to watch children who've had chemotherapy because some of it's cardiotoxic. And so we watch these kids very, very carefully. We only use these medicines if we feel we absolutely have to. But we're very careful with things that are true cardiotoxins. The spike protein is a true cardiotoxin, and we don't need it. We don't need this vaccine product, especially in children, especially in healthy children. It's shown no benefit, and all it shows is harm. So we have it is not safe, and it's not effective. And so I agree with all the others that this should be taken off the market right away. We've long reached signal for that. So I'm just another voice out here, sometimes feels like in the wilderness. And I'm sort of bewildered over why we have left first principles of medicine. One, do no harm, and then be honest and debate and see what is actually hurting our patients and remove that as quickly as possible. So I'll stop there. Thank you, Senator.
So I've got two questions. First one, again, you're talking about the spike as being harmful. People can get the spike either from the coronavirus or from the vaccine. You say you're tracking these children's history very carefully. Do you see a marked difference between potentially a child who got coronavirus and might have got spike from the coronavirus versus the vaccine? Is there a volume difference in terms of the amount of spike that a child is going to produce?
Yeah,
from the coronavirus.
Yeah, remember that the spike protein is not a normal mRNA, and so it sticks around a lot longer. So the load of spike protein for the infection, especially if they've never been vaccinated, is actually very small. It's much different, and we see that in clinical practice. I know they've been harping on this, that you get much worse and increased myocarditis with COVID infection versus vaccine. That's just not true. The JAMA Cardiology article out of the Nordic countries that did 23 million people showed that wasn't true. The least risk for myocarditis were the unvaccinated, and it went up with the number of vaccines you got. So yeah, I think that obviously I'm seeing much less problem in the kids with native COVID infections. Most of the time, they didn't even know they were infected. What I have right now, what's complicating a lot of my discussions with my colleagues, is a lot of people have a hybrid. They had COVID already, then they got a vaccine because they wanted to play sports. And so the establishment wants to say it's all because of COVID. And I go, no, it's not because of COVID. The correlation is with vaccination.
Okay, again, I'm pretty well aware of the excuse making there. Okay, but I just want to get that out there. Secondly, you do some of your practice on an island, and we're talking to the Channel Islands here, and it's just different. You are more isolated. You have your own government. Do you have any advice to offer to medical practitioners and potentially patients on the islands, based on your experience in Hawaii?
Yeah, I think that it is harder because we have to do more when we're on the islands. I'm glad that we had two different practitioners join us today. I think we have to be incredible advocates for our patients. Often what's the challenge on an island is they don't have the higher level of tests, and it's harder to get. But I think to be able to give good risk assessments to the patients, especially if you have concern for cardiac damage, then they really need a cardiac MRI with gadolinium so we can actually give them a good prognosis in terms of, because a lot of times the study out of the Lancet, in the adolescent Lancet, showed that after 90 days, about half of them it resolved. So I'd like to be able to give that good news if I can, but we need the testing. I was just at the World Congress of Pediatric Cardiology, and the #1 voted abstract was the abstract out of the consortium of cardiac MRI that said, wow, there's a lot of vaccine injury. That was the #1 abstract for 5,000 pediatric cardiologists got. So this happens in our closed doors. Now, we can talk about that publicly at the World Congress, but they'll have a real hard time getting that accepted to be published worldwide.
I didn't see that as a headline across all the major news networks. So, okay, well, again, thank you, Dr. Milhoan.